Good morning, and thanks for joining us. I'll turn to Drs. Walensky, Fauci, and Murthy in a moment. First, I want to provide an update on our efforts to protect more Americans by getting more shots in arms, starting with vaccinating the unvaccinated. We've made tremendous progress across the past 9 months. As of today, 77% of eligible Americans, those 12 and older, have gotten at least their first shot. And thanks to the President's leadership on vaccination requirements, we continue to make important progress. More than 3,500 organizations, from healthcare systems to educational institutions to state and local governments to private businesses, have already stepped up to adopt vaccination requirements. These vaccination requirements have increased vaccination rates by 20+ percentage points, with organizations routinely seeing their share of fully vaccinated workers rise above 90%. On Monday, Washington State announced that more than 90% of state employees are now fully vaccinated. That's up from around 49% just 5 weeks ago, with more people getting vaccinated each day ahead of the state's October 18th deadline. And importantly, since late July, when the President first announced vaccination requirements and called on organizations to follow his lead, the number of eligible Americans who are unvaccinated has decreased by about 1/3, from 97 million down to 66 million individuals. Every day, there's stronger evidence that vaccination requirements are working. They're driving up vaccination rates. Higher vaccination rates make workplaces, schools, and communities safer, accelerate our path out of the pandemic, and strengthen our economy. According to economists at Goldman Sachs, vaccination requirements could help return up to 5 million workers into the labor force as people feel safer going back to the workplace and face fewer disruptions, including to childcare. Higher vaccination rates will also increase consumer demand and spending as people feel more comfortable traveling, dining out at restaurants, and shopping at local small businesses. It's straightforward. People want to work, shop, and visit where they feel safe. And that's why vaccination requirements are supported by the majority of American people and are becoming the standard across all sectors. In fact, just yesterday, Boeing, one of the nation's largest employers, announced that it will require its 130,000-person U.S. workforce to be fully vaccinated by December 8th. And we will see more and more organizations adopt vaccination requirements in the coming weeks. Next, a brief update on our boosters program. By the end of today, we estimate that over 7 million Americans will have gotten their booster shot, including about 3 million just in the last week. And importantly, in less than 3 weeks, more than 1 in 3 eligible seniors have already gotten their third shot. So our program is off to a very strong start and continues to accelerate. As we await the FDA and the CDC's decisions on potential Moderna and J&J boosters in the coming days, we're working with our partners to prepare. We have the vaccine supply, and we will be ready to hit the ground running as soon as any additional boosters are authorized.
Today, I want to share an update about 2 of the upcoming vaccine decisions we're looking ahead to in the next month. Number 1, decisions about boosters. And number 2, decisions about the Pfizer vaccine for kids aged 5 to 11. Regarding boosters for Moderna and J&J recipients, VRBPAC will begin meeting tomorrow, followed by ACIP next Wednesday. So we anticipate hearing decisions from both the FDA and CDC very soon afterward. Then regarding pediatric vaccines, VRBPAC will meet beginning on October 26th, followed by ACIP on November 2nd. So we could hear decisions from both agencies, the FDA and CDC, by early November, and we will be ready to implement their recommendations as soon as we hear them. Finally, I just want to highlight that all these layers of review, the thousands of pages of data, the expert committees, and the fact that this is open to the public, they should all bolster our confidence that we have a rigorous, independent, and transparent review process for vaccines in our country.
We've asked states to plan outreach and education campaigns, focus on parents and families in the communities. And we've communicated and will continue to communicate that equity, as it has been with all of our efforts, needs to be front and center. And that means ensuring that we have sites in areas of high social vulnerability and also in rural areas. If it's authorized by the FDA and CDC, we will be ready. We have the supply. I want to emphasize it's a different supply. The dose for kids is a different dose than adults, so we'll be getting different supply to providers. We'll bring that vaccine, as we've talked about, to pediatricians' offices, also directly to schools where appropriate and to community sites. And we'll work with trusted messengers, as we have throughout, particularly those trusted messengers who can answer questions for parents and kids. So we'll make it convenient and easy for parents and kids to get vaccinated. We have the supply, and we will be ready.